Poison control centers are reporting that their calls are spiking in places like Mississippi and Oklahoma because some Americans are trying to use an anti-parasite horse drug called Ivermectin to treat coronavirus, to prevent contracting coronavirus. What would you tell someone who is considering taking that drug?
Don't do it. There's no evidence whatsoever that that works, and it could potentially have toxicity, as you've just mentioned, with people who have gone to poison control centers because they've taken the drug at a ridiculous dose and wind up getting sick. There's no clinical evidence that indicates that this works.
For a long time now, I've been reading about prominent mask opponents and vaccine skeptics, talk radio hosts and other personalities, getting COVID and dying. There have been a number of those reports in the last week. What goes through your mind when you see stories like those?
Well, Jake, it's tragic because you don't want to see anybody, regardless of what their position is or their ideology, you don't want to see anyone get sick or die, particularly as a physician and a scientist. I do everything in my entire career to safeguard the health of people and to save lives. So even if they have views that I completely disagree with, it's really tragedy to see them get sick and dying fundamentally because they're putting aside and avoiding the public health principles that we talk about all the time.